Right, let's take a look at the numbers behind COVID-19 infections in South Africa. I'm joined by Dr. Ridhwaan Suliman. He's a senior researcher at the Council for Scientific and Industrial Research. He joins me now via Zoom. Thanks so much for your time on SABC News this evening. If you could just explain to us, over the last week, what have we seen in terms of the daily COVID-19 cases? What are they doing?
Good evening, Zinga. Thanks for having me. In terms of the daily cases, we continue to see a rise in the national numbers. At the moment, the number of new daily cases on average over the past 7 days is 17,900 per day, which is an increase of about 33% compared to a week ago. Or in other words, new cases are doubling every 17 days. There's about three main reasons behind the significant increase nationally. We know that the numbers are surging in the two populous provinces, that being KwaZulu-Natal and Gauteng, and the absolute numbers in these provinces are driving the large increases that we see nationally. In addition, we know that because of the high test positivity rates in the country, as indicated by the color of the bars, the number of cases is strongly influenced by the number of tests, and there's been a marked or significant increase in the number of tests that are being processed, specifically in the past week after the festive period. And then also, because of the nature of the virus and the incubation period, we're seeing new cases for events that have happened 10 to 14 days prior. So what we're seeing are the effects of people gatherings and movement over the Christmas to New Year and festive period in general.
Dr. Suliman, I know you've touched on the positivity rate a little bit. Can we just stay with that and talk more about what you've seen it doing, particularly in the last week?
Yeah, so the positivity rate is essentially a ratio of the number of new cases as a percentage of the new tests conducted. What we have seen over the last 8 weeks or so, as indicated by the height of the bars on this graph, is that test positivity rate has been increasing for 8 weeks and worryingly up to record high levels. Over the past week, we saw that the test positivity rate has decreased by 5% compared to the previous week and currently just over 30%. And the reason for that is an increase in cases, an increase at a higher rate than what we see in the increase in tests. So that is a glimmer of hope. At least we see this measure has turned the corner this past week. That being said, the test positivity at 30% is still worryingly high. We're finding a positive case for every 2 to 3 tests conducted. Bear in mind that the guideline from the World Health Organization indicates that we need to maintain this measure below 5%. So while there's a glimmer of hope that it's turned the corner, it's still at worryingly high levels.
All right, speaking of very worryingly high levels, we're seeing over 20,000 confirmed cases yesterday. It's also happened before. How many tests are being done, and does that have an impact on the number of positive cases that we're seeing?
Absolutely. As mentioned, because of the high test positivity that we have in the country, a low number of tests for every confirmed case, the number of new cases is strongly influenced by the number of tests that are conducted. Over the past week, we've seen significant increase in the number of tests that are processed. We've seen over 70,000 the last few days. In fact, just yesterday, 77,000 odd tests were reported, which is an increase of, on average, of 40% as compared to the previous week. The reasons for this are an increase in the demand for testing, but also a significant increase in capacity, as well as the inclusion of rapid antigen testing in combination with the PCR testing that has been conducted thus far.
Mm-hmm. So let's stay with the tests. Yesterday, for instance, there were over 45,000 tests conducted in the private sector and over 26,000 in the public sector. That's according to the Department of Health and the Minister, Dr. Zweli Mkhize. Is that a cause for concern or pause when we bear in mind how many people in South Africa, quite a small percentage, around 16%, who have access normally to private health care? Or do those things not have anything to do with each other?
Well, they certainly do have an influence. If you look at the number of tests that are being conducted, as mentioned, this has increased significantly after the festive period. And up to close to 80,000 tests processed in a day, which is really impressive and commendable. At the peak of the first wave, we were seeing maximum number of tests being processed of the order of 50,000. So certainly an improvement. Overall, if you look at the number of tests conducted throughout the pandemic in South Africa, it hasn't kept up with the scale of the outbreak or the number of cases that we are finding, and that can be confirmed by the test positivity rate that we looked at previously. So because of the high number or proportion of tests that are yielding positive results, or in other words, low number of tests for every confirmed case, we certainly haven't managed to get ahead of the curve because testing allows us to identify hotspot areas, identify where the virus is spreading, but you need to do that with quick turnaround times and in combination with efficient contact tracking and tracing to be able to use that as a tool to get ahead of the curve. So the trend is increasing, but certainly not quite increasing to the extent of the outbreak within the country.
Okay, and what are we seeing in terms of hospitalizations in South Africa?
So if you look nationally, the average number of new hospitalizations required over the past week has been just over 11,600. And that's continued to increase as we've seen for a number of weeks now. It's an increase of about 12% compared to the previous week. Bear in mind that these are new hospital admissions. At the moment, we have about 224,000 active cases with a total number of people currently in hospital at around 15,000 people. The number of hospital admissions is still driven by the bigger provinces. A number of increased demand in KwaZulu-Natal and Gauteng. Gauteng has picked up by 22% compared to the previous week. The positive news is that the demand for hospitals in Eastern Cape has continued to decline, and in the Western Cape, while still increased, the rate of increase has slowed. Of note and of concern is the increased demand in hospitalizations in the other inland provinces, particularly in Northwest, Limpopo, Mpumalanga, Northern Cape. All of those provinces have seen a 50% increase in new hospital admissions compared to the previous week.
All right, and then we know that in total, over 32,000 people have passed away from COVID-19 related deaths, 399 alone yesterday. What more do we know about that death rate?
So the number of new deaths being reported daily is certainly concerning. We continue to see a rapid increase in this particular measure. At the moment, we see an average over the past 7 days of 521 new deaths per day, which is more than double that we reported at the peak of the first wave. It's an increase of 37% compared to a week ago, or in other words, new deaths are doubling every 15 days. Bear in mind, though, that over the past week, we did report about 452 deaths in the Eastern Cape, which was a backlog of previously unreported deaths that occurred between May and August of 2020. So if we exclude that, the 7-day average is 456 per day, which is still a significant increase compared to previous weeks. The number of new deaths are high in the Eastern Cape, Western Cape, KwaZulu-Natal, increasing quite rapidly in Gauteng, doubling every 12 to 13 days. And we're starting to see an increase in the inland provinces of Limpopo, Northwest, and Mpumalanga too. So these are concerning indicators.
Dr. Suliman, I just want to move away from the numbers of the week and look at the way we in South Africa process the data around COVID-19. Our former Statistician General, Dr. Ridhwaan, has said that there's perhaps a gap or something missing in how we report COVID-19 stats, and I want to quote him here. He says, by design and observation, the data does not lend itself to population level estimates because the observations are not random, and consequently they have an unquantifiable factor by which they could be raised to the universe to arrive at credible estimates of prevalence, evolution and progression. And he spoke specifically in that IL article about how when it comes to recovery, we do not have proper statistics or data. What do you say to that?
Look, there are limitations to all of the data. Each of the measures, by their own right, have limitations. And we need to bear in mind that it is something that we continue to work with to improve. We need to understand what we're working with and bear in mind also the limitations in each of the measures. Cases are limited by testing. Testing is limited by quick turnaround times. We rely significantly on accurate and timeless reporting. Death numbers may not include all directly COVID-related deaths. So they all have limitations, but if we take a look at the overall picture and, more importantly, the trend in each of these measures, I think we can still learn a significant amount and be able to understand where we are in the pandemic and how to go and use the data going forward.
Dr. Ridhwaan Suliman, thanks so much for your time. He's from the Council for Scientific and Industrial Research, joining us via Zoom there. It's time for a short